Good afternoon, everybody. I'd like to call to order the meeting of the Public Safety Committee for July 22nd, 2025. First item of business, are there any changes to the agenda? And I believe there's an added resolution committee members should have on their desk regarding College Initiative Upstate. I'm not aware of any other changes. Okay. Next item is public comment, and I do have 3 blue sheets. I call the people, and I think you all are familiar with the rules. So when it's your turn, please come up and talk to us. First up is Zach Wynn.
Good afternoon. I see that on today's agenda, the jail numbers are being discussed. I also noted that the high numbers were remarked upon during the last meeting of the legislature, where it was wondered aloud why they were so high. I believe there is a connection between the large population of the jail and the methamphetamine problem that is so prevalent in the county. There have been several recent large seizures of meth, with 90 grams seized at the Green Street parking garage and 2 pounds seized during an arrest at the Seneca Street parking garage. There are clearly a lot of meth users in the area, and it is a drug that has a corrosive effect on people's minds, more so than virtually any other drug I'm familiar with. Combined with fentanyl, meth is doubly damaging to an individual's mind. It induces psychosis and causes erratic behavior. There isn't anyone at this meeting that if they were to become a habitual meth user would not eventually have trouble with the law. It transforms people almost irrevocably. I am hopeful that a more meaningful effort to address the meth crisis in the county can be formulated. I have previously suggested the creation of a methamphetamine task force that would mirror the responsibilities of the opioid task force. And until the root cause of the jail number increase is addressed, the numbers will continue to grow. Please address this crisis head on. Thank you.
Thank you. Next up, Eliza Solomon. Did I pronounce that right?
Salomon.
Salomon.
Yeah, that's okay.
Welcome.
Thank you. So my name's Eliza Salomon. I'm a resident of the city of Ithaca, and I'd like to speak about concerns regarding the flock cameras that were brought up at the legislative meeting last week and that I believe are going to be discussed today as well. It feels like every day there's a new story about flock cameras being used for purposes other than those intended all around the country. Flock is being used for immigration enforcement and anti-abortion surveillance, and as I've started to notice them around the city, it's hard not to, including one just a block away from the Ithaca Planned Parenthood. The director of technology at the ACLU recently stated that Flock, quote, is trying to build a nationwide authoritarian surveillance system. And from Ithaca's publicly available Flock data, the past month saw 5 lookups just labeled as investigation. And with so many different counties having access to our data, it's easy to feel unsettled by this ease of access and lack of clarity. I also want to talk about a city that recently decided to cut ties with Flock. So in early June, Austin, Texas ended its use of the program after finding thousands of instances of data misuse. The city's contract with Flock allowed the company basically free reign over all of their camera data, and all of the safety guardrails they had put in place had failed. Flock is only continuing to expand its surveillance capabilities. A leaked quote from an internal company meeting recently, an employee stated, "You're going to be able to access data and jump from license plate reader to person and link to other people that are related to that person." Given the lack of clarity surrounding the county's use of Flock, the potential misuse of data and access, I think a thorough investigation and pause in use of the cameras would give the community time to carefully review and consider their increasingly dire consequences on our community. Thank you.
Thank you. And Amanda Kirchkessner.
Good afternoon. Some of you heard my comment Tuesday evening, which wasn't an easy one for me to get to, but I think something that's been sorely absent in the conversation about reimagining public safety is reimagining the foundational structures of public safety, largely the public safety building, otherwise known as the jail. I know that having had a close friend in there for about a month and learning about his experiences firsthand through routine visitation, what we have presently is not working, and certainly not working for the most vulnerable people in our community. Because the jail, as Zach mentioned, is largely containing people with active drug dependencies, we're putting a lot of people in harm's way. And we need to invest in more resilient structures and staffing so that we can adequately provide for the people who are the most vulnerable in our community. Obviously, I don't think drug addiction should be punished as a crime, but people who harm other people absolutely need to be contained in a safe and respectful manner. I know that there's a county government building that we have achieved funding for. It's a waste of money. I mentioned on that Tuesday evening, we have a vacant ground floor of Herald Square, which is very close to the City of Ithaca government building. We have a vacant convention center, near vacant convention center in the Asteria building, where a lot of our jail frequent flyers reside. I strongly encourage this committee to really trust our leadership in public safety and work with them and people who have been incarcerated and who are currently incarcerated to discuss what they actually need up there. They need more supervision so we can explore programs like work release so that people who need a little extra encouragement to stay clean have it, but they need staffing in order to provide those services to our community. We can create pathways that actually allow individuals to become bread-earning members of our community while getting on the straight and narrow. Is it the perfect solution? No, but is it working with the tools that we have? Absolutely. We need to get creative. The federal government is not gonna help us. You can go talk to Josh Riley after this meeting and he's gonna tell you there ain't nothing that they have to offer. I mean, building a wall around Tompkins County out of pig poop and pallets is probably the best option we got at this point in time. And I think we really need to think about helping the most vulnerable people through the agencies that we do have in place. And we have a bang-up sheriff's department. They were out front of Grassroots all weekend, not a single arrest. People had a great time. Thank you very much. I yield the rest of my time.
Thank you. Okay. Is there anybody else who wishes to address the committee? All right. I have minutes from June 24th, 2025. Could I get a motion? Lee moves. Shauna seconds. Questions or comments on the minutes? All those in favor? Okay. Those are unanimous. We can move on to Chair's report. And I know we have some guests. I might switch the order. We're going to discuss the increase in the jail population. I was going to consider our additional resolution, but we have Tylee Magambi and Paula Ioannidis with us to talk about ultimate reentry opportunities. And I think we're going to take about 15 minutes. Welcome.
Thank you so much. Can everybody hear us okay and see the presentation?
Yes.
Wonderful. Tali's going to kick us off. Tali, I think you're muted.
Oh, sorry. Yeah, I was muted and off video. Hello, everyone. Thank you guys for allowing us to come and speak to the committee on short notice. We're here to talk about the Ultimate Reentry Opportunities Beyond the Box initiative that this committee helped support and get funded in 2023. So we're here to talk about this process and the results and our steps moving forward with your support. So just starting us off, Ultimate Reentry Opportunity Initiative started back in 2011, collective impact-driven initiative, kind of founded on the basis of some of the work that was happening in our community, primarily by just individuals seeking to impact people's lives in a positive way. So one of the individuals, no longer here with us, but we love to pay homage to, and especially with this quote, the entire world is my birthplace and every human on it is my family. And so we try to take that approach in our collective impact approach to this work, recognizing the humanity of every person and the needs that they have. And so our motto is humans humanizing humans. And that is the work that we think is the most important, right? Is the mindset shift from being a punitive approach to one that is of restoration and rebuilding and connecting. So our work in facilitating systemic change in employment in Tompkins County, the reason why employment is crucial and key, when we did our initial assessment of the challenges impacting people in the carceral system here locally in Tompkins County, and all of the various social determinants of health, employment came in number 2 behind housing, obviously. And so in order to really address the challenges, we had to really look at the bigger picture of what's going on. So we did that locally, we did it statewide, and we did it nationwide. And we really looked at probably over, at that time, it was exactly 100 different initiatives back in 2017 when I first became a director, looking at over 100 different initiatives across the country to see what worked, what didn't work, what really reduced recidivism. And so that really helped us to kind of drill down and look at, okay, so now we see what works and we see what's happening nationally and locally. What are the root causes of some of the challenges that people are facing in all of the areas that are impacting their lives as it pertains to these social determinants of health? We brought in folks with lived experience and their expertise, and also content expertise in terms of researchers, folks who work in these fields and these spaces. You can actually look at who's on our team on our website under research. And after this research was done and all this information was gathered, we then also brought people together in what we call summits, where everyone was able to discover the impacts around them in terms of folks working with people in reentry, whether that's housing, whether that's employment, transportation, health and wellness, and then to distill down what's going to be the work that's going to be most advantageous for people's success here in Tompkins County. This right here is just kind of a diagram of our theory of change, how we hope to impact change in our community. As you can see, we just told you about how we define the problem, engaging community. As many stakeholders that we can possibly engage with that are interacting with the population so that those voices are brought to bear. We bring the power of those voices together in creating working groups that then help to decide the trajectory and the work of the organization. Some may think that, Tali just decides a direction. No, it's really, distilled down from all the information from our stakeholders. We then take the information and the data that we've collected and we turn that into action plans. We work with our partners. For example, Sunflower House, as you guys know, was organized, was a collection of work from INHS, URO, and OAR. OAR is the actual executor of this initiative. And then we look at what are the challenges that happen in this process of executing this vision, and then we refine the process, hopefully to reduce recidivism even more. Next slide. And so this is just a snapshot of this process that we took, where we initially began as we started out with Gino Bush's quote, Gino Bush Beyond the Box Reentry Fair, where we had a fair. Employers are interested in hiring people, justice impacted people, but there are challenges in that. And then with that information that we gathered, we actually developed the qualitative study. From the qualitative study, we then moved into kind of reporting our findings and information about what happened, what people reported. And this was not just the people impacted, but also the service providers. We had employment summits for further digging into the information from the folks who are working with the population. And then we went for funding from this very body here. That body promoted this idea and concept back in 2022, 2021. In 2022, the first pilot began. And then here we are. If we just fast forward where we are now, we've done our pilot this is Sunflower House, but for the Beyond the Box, here we are after a year of running the pilot and here to kind of disseminate some information to you. So there is this kind of feedback loop, right, where we go through this process, gathering information, putting the pilot into process, gathering more information, and then disseminating that information so that folks can execute the best practice. And then from that best practice, hopefully the idea is to scale the project, which we're here to kind of advocate for. So the Beyond the Box certification, this is an opportunity for employers to actually go through a process of becoming a Beyond the Box certified employer, which means we're not just banning the box, which means that checkbox that says, oh, we don't look at criminal records or criminal history. That information will actually eventually get looked at, and we're working on solving that challenge of background checks and screenings. But this process of the Beyond the Box is a rich process. When you think about when we send someone to school to go and learn something, say, for example, your children, all your children, right, if you have any, they go to middle school and they're asked to learn algebra, and you teach them algebra in the classroom. And then what happens is they have to do their homework, and then they come back and they show their homework, and then they have a test, right? This Beyond the Box process is similar to that in that we're not just going to provide a training and then expect you to get it. This process is going to help you work through the problem solving of what does it mean to employ this target population? What does it mean to conduct outreach? What does it mean to create an environment that's conducive for not just their success? We really look at this population as the most vulnerable population, very stigmatized population. And so when we're able to address all of those issues, then we have a more inclusive, thriving, and vibrant community where people feel included, can get beyond the stigma, and can actually be successful. And so last slide here. So why is banning the box so important? Trainings aren't enough. As I said, carceral stigma, carceral trauma. Many of our participants have had lifelong histories of trauma, adverse childhood experiences. Trainings are not enough. You need the tutelage and the guidance and the coaching. And then lastly is the feedback loop that we provide, where you have a navigational specialist, someone who's following the employee on a week-to-week basis, engaging them, finding out what their challenges are, what their successes are, and feeding that back into the loop with the employer, so the employer knows what to change and grow with. And so with that, I just wanted to give kind of a background information on this process. Paula will kind of go through what that really looks like.
Thanks, Tully. So really, we're here to thank the county for funding the Beyond the Box pilot initiative, which was a one-year initiative that we engaged Moosewood Restaurant for. It's a small employer, but deeply committed to hiring people with past criminal records and retaining them and sustaining their employment. The Beyond the Box initiative moves beyond the box in that it is really working with both employers and employees who are justice impacted to really make that in-depth cultural shift, policy shift, and organizational transformational shift that is required in order to not just allow people with past criminal records to come into the door, but to really sustain them in employment along the way. So here, for our pilot, we engaged in a research process in part because we wanted to learn from what it is that we needed to improve for scaling this pilot, which is really the next phase that we're looking at. But the process essentially begins in a customized assessment of what the employer's needs are. What we're recognizing is that there isn't a cookie cutter approach to second chance hiring. Each employer has industry specific needs, organizational specific needs. So we really start with an assessment process to determine where are the interventions needed, where do they think they need to make policy changes or organizational cultural shifts. We then work with the employer to present those findings from that assessment, and we bring our recommendations for where the interventions should happen. There is a training component specifically for management and to some extent for staff, because we want to create workplaces that are inclusive, not just for people in reentry, but for people of any kind of vulnerable and marginalized positions. And the perspective we take is that essentially if we set up a workplace successfully to be conducive for people returning from jails and prisons and with those past justice involvement histories, then we're in some ways setting it up well for people of any marginalized position. The implementation assistance is a piece that we largely work with the employer to shift specific policies, whether it's in their hiring policies or in their hiring practices. Sometimes they have great policies in place, but they're not translated to their management. And the same for workplace policies. They might have fabulous sick leave policies, support for their employees policies, but they're not necessarily translating to how the managers are conveying that to people who are justice impacted. And so it's affecting the retention rates of people who are looking to sustain employment. And then after all that, we do a kind of post-intervention assessment for how they can continue doing the work. I'm not going to go into great detail about this. We'll share the presentation with you. But one of the things we do is a culture survey, as well as one-on-one interviews with justice impacted folks who already exist within that organization, because we feel that people closest to the problem are also very well situated to innovate the solution. We do a policy review to see which workplace policies, whether in hiring or retention, might need to be modified to really improve second chance hiring experiences. In Moosewood's situation, they actually were doing fabulously well on their policies. What they needed a lot of help with was really more in translating those policies to effective and consistent management practices. So we identified essentially different areas of intervention with them, and some of that was essentially through those different assessment tools. We then presented those findings and worked with the employer to agree on the interventions. And in the Moosewood's case, we did 2 workplace trainings, one on non-inclusive behaviors and challenging those in the workplace with a focus on people in reentry. And we also did an inclusive management training for their management staff to really think through, how do you triage, how do you work with people who are justice involved to make sure you're really coming with a compassionate, curious lens to their situations, which is often encumbered by a number of systemic challenges. We worked on developing equitable procedures and processes with them so that they would equitably apply those same workplace policies across the board, and improving their communication practices, because a lot of that wasn't necessarily translating to their staff. And so employee and management learning development was very customized. And from that, essentially, they took away some of those overall workplace trainings, but quite a bit of technical assistance was needed to give them that kind of employer-based technical assistance. How do I actually get from A to Z? But we also had a navigational support specialist working specifically with people who were justice impacted at Moosewood to really understand in a very granular way, what is it you need assistance with to sustain this job? Is it digital literacy? Is it financial literacy? Do you need assistance finding housing? And it turned out that a lot of that navigational support pointed back to some of those system challenges that we're all too familiar with here, such as finding affordable housing nearby downtown Ithaca, right? So when we ultimately kind of developed a process with them to prioritize the interventions, this is essentially some of the tools we gave them and some of the both employer and employee-based kind of technical assistance and really hand-holding them through the process, right? And then we produced a report which we shared with the Public Safety Committee on lessons learned. What we're really looking to do now is scale our initiative. So you're going to receive an over-target request from URO. The HSC has already blessed it with its endorsement. But essentially what we're looking to do is we worked with a very small level employer of up to 30 to 35 employees, Moosewood. What we'd like to do now is scale this and take the lessons learned from that pilot and scale it with a mid-size employer or with a cohort of small employers, right? But that essentially it gives us the ability to help them navigate and give them that technical assistance, both for the employee side and the employer side. And so again, depending on the funding that we receive and the training, and we do expect employers to also contribute to this effort. For example, in subsidizing some of the trainings or some of the consultant work that is needed to really give them that technical assistance. But really what we're also looking to fund is that navigational support, because it is really critical to pair the people who have the employment, have gotten their foot in the door, but want to retain that job. They often need assistance with other social services, other kinds of benefits, other kinds of supports in order to continue staying committed to the job. And like I said, we continue to work in the collective impact model on things like housing and transportation.
Paula, sorry to interrupt. We're over the 15 minutes.
That's it. That was the end. Thank you so much.
See if there's any questions or comments from the committee members. Yeah, Veronica.
I guess keeping it brief, one, thank you for presenting this report. And it seems like I guess I want us to, like us here in this room, pay careful attention to it going forward, because I like the level of detail that you've been able to get to with Moosewood on like tracing our like policies and goals and people like at all these stages through planning and implementation. And, you know, I don't have all that language, but stuff gets missed and dropped all the time. And we don't often have like this type of research as opposed to like pretty broad things. And then my question is, in the report that you shared with us in the agenda packet, like the written version, you've got 12 recommendations to Tompkins County employers and community partners, set into 4 categories, and obviously we don't have time to address them specifically, but are you all, and maybe this is more for Tali, planning in the near future more summits or gatherings at which, you know, we, the county, and others could discuss these things with community partners? Because it's all that, those conversations would be a good next step.
To answer your question, yes, definitely. So I think you were in attendance at our last summit this May, very powerful, where we had individuals from upstate and from downstate come all the way here to Ithaca to look at the work that we're doing. We've been met with a lot of enthusiasm about the potential impact of all of us getting together, including the governmental stakeholders, to look at and evaluate what we're doing at the ground level. So our hope is that we'll have another summit in about 18 months time, after we've committed ourselves to some of the work that was outlined in the summit.
And I'll just add, Veronica, that we had an employer-focused summit at the library specifically after we released this report. And what employers consistently say is that they really do need this customized approach, that a kind of, they all are aware of second chance hiring, but they don't know how to operationalize it within the context of their organizations. And many of them said at the HR level, they're pretty aligned on the policies, but they don't know how to translate that to management practices and to the soft skills and kind of cultural dimensions of the organization. And that's the translation we're hoping to usher people through with the Beyond the Box initiative. And we already have a really committed group of Tompkins County employers who have expressed interest in continuing that effort.
Okay, Shauna.
Okay.
Yeah, I just want to say thank you for going through the Human Services Coalition process. I think that it adds value to your application, and I think whenever we streamline all of our nonprofits going through our vetting process and having people that are deep in the trenches making these decisions on what's best for our community and allocating funds, I think it it doesn't necessarily make the money going out of our county a popularity contest. Like I feel like sometimes it traditionally becomes with legislators latching on to nonprofits and bringing them in with OTRs. So I want to say I think that adds to your credibility and the work that you're doing. Can you tell us how much for this upcoming project is going to be allocated through the Human Services Coalition, or what they're recommending?
Yeah, it's rounded up to about $49,000.
Okay, great. Thank you.
And just to piggy off that point that you just made, right, we initially started this process just coming straight to one of these committees, and we've learned in that process. So that is an education that I think many community organizations need to go through. And then lastly, something for this committee to chew on is the fact that we do not have true, meaningful, deep, trauma-informed resources for healing. This is the healing piece is key. Many of our population folks, they get the drugs, they get the prescriptions, but they don't get the healing. And if we're going to really solve this problem, the county needs to find a way to devote itself to healing people. And that's a long, arduous road, but at the end of it, it's much more success. So that's my word.
Okay. Anybody else? All right. Well, thank you for the presentation and your time. All right.
Thanks for having us.
All right. Let's keep going. I don't see anybody here from probation.
He just got on.
Oh, he did? Oh, there's Dan. Okay. We have, then I will address this resolution. We have authorization of use of space lease agreement with College Initiative Upstate for space within Tompkins County Probation and Community Justice Office. ID 13446. Could I get a motion on that? Veronica moves, Lee seconds. Dan, welcome. I just wanted to make sure you were here to speak to this.
I apologize for being late on our way back from our budget presentation. Carla and I had to assist an overdose victim on South Cayuga Street, so.
Wow. Okay.
Running a little behind. So I apologize for that. Yes, the College Initiative Upstate embedded with us for a few months. It's become a really good partnership that we're really interested in adding as an extension to our day reporting program. The space that they're proposing to lease is housed in the day reporting area, which allows them access to our day reporting clients as well as people on the probation side to be able to do warm handoffs. And it's worked out very well.
Okay. Any questions or comments from the committee members? This seems like a very sensible arrangement, and it happened sort of by accident with the move from the M&T building, but it does seem like
Rich, I'm here also, Sharon from OER. I'm here, the director of the College Initiative Upstate program.
Yes,
and
welcome.
I am ready and willing to answer any questions that the committee may have.
I assume it's working from your side as well.
Absolutely, absolutely. Had a few warm handoffs just last week, and so far it's been great to be a part of a larger, richer system and have definite access to people who are justice impacted. And so it's going to strengthen us. And we have some plans to update and change the way we work to make it more effective for the clients and the staff and the community as a whole. We're working on a strategic plan to just do things in a more streamlined way and to also increase our presence as a recognized ATI in the county. So we are doing all of that, and hopefully we'll have some traction before the end of the year.
All right. Well, thank you for that information. Any questions or comments? Veronica.
Just a comment. I know we hear a lot that that co-location of services or things that people have to go to is important, or maybe that we hear that when they're physically separated, even just in different buildings, people get lost in the cracks. So this is great that this is working out. And Dan, I just want to thank you for having your priorities in order to help a person rather than being on time to the meeting.
Yeah, it's a pretty clear decision right there. I apologize for being late.
You don't need to apologize. Are we ready to vote? All those in favor? That's unanimous. Thanks for coming in, and good luck going forward. Let's move on.
Thank you all.
Yeah, let's move on to our discussion and examination of the increase in jail population in Tompkins County. And I took a liberty here because I was trying to figure out how do we go about having this conversation. And it seemed like, as my son, the mathematician, would say, this is a multivariable problem. In fact, there's lots of variables we're trying to understand at the same time. And what I came up with was I would suggest that we do this in a two-stage process, that we try to first identify questions that we want to try to answer, and then at our August meeting, we come back and try to have more information on each of the questions and quantify where we might be. And the liberty I took is I prepared a PowerPoint, and I know people are going, oh no, a PowerPoint, but it's not too long, and we'll go through it fairly quickly, but it, let's see. I gotta see how do I get a PowerPoint up? Share? Okay. Various things telling me, okay. Let me do that in presentation mode. How do I get there? I should be, I do this in my class all the time, but I can't see.
Maybe under slideshow?
Oh, it's not letting me get to slideshow. It's hiding that. Let's see.
Oh, I think you can click.
Slideshow. There we go. Play from start. Okay. So what I did was just a series of questions. And I would say there is a trend, but we shouldn't take that for granted, that maybe this is just random. I would argue no, but let's make sure we answer that question. And is it a result of just more criminal activity? I think we should answer that question, that is there just more going on that's leading to more people in our jail? And is it more people, or is it the same people and we have a recidivism issue? I think we should touch on that. I guess staying longer or returning, repeat visits. And are we just seeing some clog in our process that's leading to people sitting in the jail longer, waiting for trial or waiting for hearings or waiting for some disposition? I think we need to try to address that. And then we've spent a tremendous amount of time and money building ATIs. And I don't know that we fully answered the question, are they what the judges want? Are they using them? And that's that question there. But this one, do we have the right ATIs? I think we should think about that. And then are they being used? And has there been some change in what courts are doing? You know, are we seeing just more judges sentencing people to jail, or is it just something else? And we've certainly had conversation about this question, that we're seeing people held in our jail while they're waiting to go to a state prison. And we seem to have seen a little reduction there recently, but is that playing a part? And if so, how many? You know, this is an issue certainly, but it seems to be finite in that we're probably less than 10, but we should try to quantify what that is. And the Give Grant. This has certainly been a real change in our community in that we had a lot of gun crime going on that has been tamped down, but the alternative that's arisen is I think we're probably holding some more people in our jail as a result and putting more people into prison. And we also certainly have more people in our probation process, which is a separate examination, but give seems to be a factor in some way, and we should consider that. We've had bail reform. You know, that probably should lead to lower jail numbers, but really before jail reform, Tompkins County was doing everything possible to not keep people in jail that were bailable. So I don't know that it's made a lot of difference, but we should probably consider it. We have been waiting for years for this, and it does seem like the latest answer is towards the end of the year. And I think this is an obvious question to look at, where I think I'd really look for some insight from our jail captain, if I can pick on you, when we get to this, is quantifying what's the number. How many people would we see not in our jail if there was a detox facility available for them instead? And the same thing with the Crisis Stabilization Center, you know, that will hopefully be up and running and would provide an alternative location to send somebody who's having a mental health crisis and nobody knows quite what to do. But again, if we could try to quantify it, which might be really hard, but I think that's the task before us. Obviously, with the Drug and Alcohol Council closed, we've seen a real reduction in drug treatment beds available. And it would be, I think, really helpful if we could try to quantify what impact has that had on holding people in our jail. And, you know, certainly doing nothing is one of the things we tend to do pretty well. Is this an option? You know, that we just watch it go down. It seemed to trend up, or has trended up, but is this just an ebb and flow? I think we want to really address that question, that maybe it will resolve. I'm not sure. And then this one, I'd open up the floor. But before I invite the conversation, I'd say we have committed to doing some renovations, well, a new public safety facility, and we've committed to maintaining the same number of beds. There's certainly some reasons to do that philosophically, but we do need a facility that's adequate to our needs. If there's a new normal where we're really close to our classification, realistic numbers we can hold in our jail, maybe 81 or 82 isn't the right number. You know, I hesitate to say we should think about building a bigger jail, but if we answer these questions and we say, really, something has gone on where we do need a bigger jail, we should know that now rather than building something and then saying that wasn't big enough. So anyway, those were the questions I thought of, but I'm sure there's other things we could think about, and I'd invite comment from everybody. And Lance and Matt, if you want to come up too, I don't know if you have thoughts on where we should be looking to try to answer this question of why our jail numbers are where they're at. But I guess I'll go to our sheriff first.
Yeah, I'll certainly turn it over to Captain Harrison, but I know as of today, our numbers have stabilized somewhat. We have 63 today. We only have 2 state readies. And I think when we first started talking about this, Rich, a few weeks ago, we had somewhere 6 to maybe 10. We were waiting on from this for state readies to be transported out of our facility. It seems like that aspect of it, at least, has gotten much better. We currently don't have any board outs. But certainly when I look at, you know, the size of our facility, I wouldn't say it's so much the size of it, it's the space and how it's utilized with the old system we have and the need to create better living conditions with the pod systems we've talked about for a number of years. But when it comes to size, I will say we need more opportunities to be able to separate people, house them based on special needs, when it comes to discipline, having a place to put them. That's where I see us really struggling, but I'll certainly let the captain add if you have anything beyond that, or did I summarize it pretty good?
You summarized it pretty good.
All right.
If you can use a microphone, yeah, about 6 inches away from the microphone.
All right.
Look closer.
No, the sheriff summarized it really well. Really, when you do start to look at the potential of a change in, I'm going to say, population size for a facility, you want to definitely take into consideration, are we looking into what we need for additional programming space, additional space for medical mental health treatment, drug and alcohol treatment as well. We all have, every county facility now is mandated as well state for the medication assisted treatment that we do inside. And having locations that are more acceptable and accommodating to provide those services. The sheriff is correct. We are stable right now for the last few days at 63, between 63 and 64. Prior to even discussing the increase in the population numbers, we were in-house at 78 with housing 15 inmates out. That was, it had a lot to do with, at one point we had 17 state-ready inmates with the closure of intake at state docks. Currently we only have 2. They have opened it back up. In the next few weeks they're anticipating to be able to take up to 450 a week from all county facilities in the state of New York. And that was, we actually, I mean, just from the size of our facility, we are, when we had that many state readies, we were comparable to some of the larger facilities that had 150 to 200 state readies. And so we were losing our space. And like the sheriff says, the classification is a huge one too. If we have a fight in a block or in the dorms, we have no place to separate these individuals, especially just for a cool down period, or even for if there's assaults, making sure that we keep them separate.
And if I could just add briefly, Rich, our 82 bed capacity, they like us to stay at around 80%. That puts us right at 65.6. So when you look at it from that perspective, we're close.
Very close, yeah. Do you think those questions capture what we should be looking at?
Absolutely. Yeah, definitely.
Do you see anything else we could add to that?
Nothing came to mind when I...
Okay. Lance, Matt?
Sure, I'll go first. I think I have looked at the numbers of people housed in jails across the country, and I think the national average per 100,000 is about 150 people. And certainly in places across New York State, Broome County is an example I use sometimes. They have 400 people in their jail at times, and they have like twice as many people as us. So looking at our jail with a 82 capacity, if we were not factoring in that this is Tompkins County and we try really hard not to incarcerate people, we wouldn't have enough beds. But I think 82 will be enough. I think that one factor, I think the questions that you asked are the right ones. I can't think of anything else. The GIVE program, the number of people that were shooting at each other over a period of time, that's a finite number of people. They don't pop up again. It was a group of people that were shooting at each other. Many of them are in jail. Their cases are processing through, and when those cases are resolved, those people will either have a trial and be found not guilty, or they will be somewhere else. And so that number is probably 8, give or take, that will not be in our jail anymore. So that's a number that will reduce by. But just looking at the individuals who are in jail now, we do take that recommendation very seriously. It's not always in our control. Sentencing is not in our control, but there's only 3 people that I see serving a sentence, a local jail sentence. I count 14 violent felony and separately 8 gun cases. There are 11 serial offenders, people that get arrested over and over and over again. That's the only result that you can end up on is some level of incarceration. There's a dozen domestic violence category cases that I can count. And these are rough numbers, they're not precise.
Yeah, I guess I'd look for us to have the more precise stuff in August.
Sure.
But today, just I guess my question to you is, are these the right questions to ask? Do you think there's other areas we should be exploring?
No, I think they're the right questions. I'm just kind of identifying that
there's
the
categories.
people who are in jail now they're serious cases, and that is somewhat cyclical. So I think we're due for a downturn, knock on wood, in those serious cases.
I'm sorry, go ahead.
Yeah. Jen?
The only thing that I would add is I think looking at the Crisis Stabilization Center and the Detox Center are important, but those solve acute, immediate issues. There's nothing, and I think we should look at what we're lacking long-term. There's a population that we see has serious psychiatric issues, and they're not receiving the long-term care that they should be getting. So we're seeing them come in and out. I think right now we're waiting on 3 730 evaluations where they might be found incompetent to participate in their own defense. So sometimes we wait to be able to find them a bed so that they get the psychiatric help that they need, so they're in our jails longer than they should be. And then depending how how their case works out, they're still not receiving that psychiatric care after they serve a sentence or they're released. So they're finding themselves in those repeat situations. So long-term care is important to look at too.
So maybe there is a question that is separate from the ones I put in here about longer-term mental health support. Mm-hmm. And certainly this is the conversation and debate the legislature had this spring about Governor Hochul's proposal that has now become law. And maybe we need to think about that. Is there something we should be doing to take people that would otherwise be in our jail and have some place for them to be where they can get longer term mental health treatment? And that's an expensive question, but maybe. Yeah. Lance, I'm sorry.
I was just going to follow. I think these are mainly the right questions. One, and I'm not sure how you put this question, but in terms of, and something we can address in terms of are people staying longer, one of the issues contributing, I know from talking to other chief defenders, it's not linked just to our county, is kind of a pandemic fallout. It's become much more difficult. I know some of our judges have noted this, in getting people to agree to resolutions where they probably should, or wanting to go back on a resolution and go to trial. I think that's maybe a temporary issue. That question of will trends, I kind of agree. I think we're going to trend down a bit anyway. The one other issue that may impact us on state ready, chief defenders have been having a number of conversations with DCJS and other people in Albany. I'm not directly involved in those, but I know there's an increased focus, which doesn't directly impact us, on a lot of these other facilities have had a number of people are still holding people who are docs ready who are becoming CR eligible or max expiration, which means they're reaching the dates where if they were state incarcerated, they'd be released on parole, hitting them in the local jail. So people are trying to target that. To some degree, that may impact us in terms of, as the captain said, through the end of the year, there's going to be a smaller number of 400 and somewhat a week statewide. We may fall down on that list a bit because from my count, we tend not to have people who are reaching a CR date before their
Sorry, what's CR? Conditional release?
Conditional release date, sorry, yeah. That's the date you first become eligible for parole. They have oftentimes nonviolent offenders, that's the date you're looking at to parole back into the community. And the max expiration is that's the max expiration of their sentence. Apparently there have been a few people statewide, not here, that went beyond their max expiration date, waiting to go to docs. So they'd serve their complete sentence and they're still in a local facility.
So the question that I took from that is, are there defense reasons for counsel to delay resolution of cases?
Generally, unless the issues from the defense side that mainly will delay a resolution are mental health cases. I know I had one that ultimately became a NGRI. That was a bit of an extreme case, but you have to get the records. If you're going to do first thing you do, you hire a forensic psychiatrist.
Sorry to interrupt. What's an NGRI?
Not guilty by reason of insanity. It really means not guilty by reason of mental defect or disease. Typically, there's somebody who's schizophrenic has been our usual pattern here, and are psychotic at the time of the incident. A forensic psychiatrist will say, I need to see all the mental health records, and they're going to do their own diagnosis. I had one case where that meant CMC, Tompkins County Mental Health, Binghamton, hospitals in New York City, New Jersey, Marcy, Rochester. I had stacks like that, and that's not that uncommon. That'll delay because you've got to do subpoenas and wait for them to arrive, send them. So that can delay.
But for August, what would be helpful then is to quantify what kind of number we're looking at would fit into that category.
Right. I think what you said initially is not the attorney, it's that they're the personality of the individual facing the charges, as they've decided for whatever reason. They might have a reasonable offer on the table and they've just decided they're taking plan C, which doesn't exist.
No, that's what I mean, yeah. I give you an example. I had to take over a case, a client who had 2 burglary seconds, which, because of their history, either one of those, if convicted at trial, would have been a mandatory life imprisonment sentence. It's so many years to life. Had a plea and wanted to walk it back, and it's like, I'm going to trial, I don't care. And we were able to resolve that and get a plea back. Matt's office cooperated with us. We worked that up, but we're running into that type of thing. It's just, as Matt said, they want Plan C, which...
And you think this is new and different since the pandemic?
It's becoming more prevalent that when we make a proposal for a resolution, we take that seriously. We think about it. It's not arbitrary. The defense attorneys often think that it's fair, but they can't convince their client that it's fair, and the client wants to hold out for something better, which typically doesn't exist. And if you go to trial, there's often consequences that we don't have any control over that may not be, they may be worse than what the proposal is.
Yeah. No, part of this, we've had a set of other people at the jail who have been encouraging, no, don't do that. You go stick for Plan C, and interpret the law and the facts the way they want to.
They don't have law degrees.
Yeah. We have a lot of lawyers at the jail right now. Fortunately, they don't bill.
Okay. Dan, did you get a chance to see these questions, and do you think there's anything else we should be thinking about in August?
I was able to see all the questions. I think they're great questions. I can't think of any additional. I think you've covered most of it. I have some numbers that were actually provided to me yesterday and this morning, that may be valuable for the conversation. Our dashboard's pretty valuable resource as well. We're currently supervising 493 adults. We have 23 individuals under supervision for give-related offenses, 48 people in drug court, 17 in wellness court. And recent numbers that were given to me yesterday, and looking at our day reporting numbers, we served 148 individuals that were released to day reporting on a pretrial basis only, not sentenced individuals, from January to June of this year. That program seems to be functioning at a high level right now, but I know in other numbers that we've had 52 individuals released from probation so far this year. 24% of those individuals had been rearrested, 7 for a felony, 7 for a misdemeanor. 75% of the people under supervision that have completed so far this year were not rearrested. And a lot of other numbers that may be of interest to you, but one of note is 75% of the people that we've taken that were just released from probation this year, 44 of those, or 75.9%, came into us with mental health issues. And that's in addition to the individuals who came in with substance abuse issues. We have, we're down to one treatment agency in town. I think they're probably overwhelmed with the number of outpatient cases they're trying to handle. The mental health clinic is strained as well. So I think those are all contributing factors to people continuing to struggle. I caught the tail end of the Lee's presentation, and just, part of being a caring, compassionate community is identifying the resources that are needed and providing them. And I think the crisis stabilization program would be helpful, but also more access to outpatient counseling for both mental health and substance abuse involved individuals would help our outcomes.
Okay. All right. Veronica.
I have a couple things. First, it was a while ago, but I saw Sharon had her hand up. Did you have something you wanted to say if you're there? Maybe not.
Yeah, I missed that. I'm sorry.
Okay. Yeah, it's easy on Zoom.
I am here. Because the questions opened up with talking about alternatives to incarceration. So I just jotted down some deeper dives for that, but it seems like the conversation went in a different direction. So maybe that is a discussion left for another day. Just wanting to just be clear about what is exactly that courts expect when they deal with community-based organizations that want to identify as an ATI. As I said earlier, when I was, giving thank yous for the use of the space, and I explained that in College Initiative Upstate's strategic plan, we want to have a stronger presence as an ATI in the community. And that will be part of the strategic plan discussion. So I just wanted to check in, I guess, to find out what can we do differently or better or something like that, or overall, not just specific to CIU. How do community-based organizations become credible or a legit or certified ATI? We are always interested in preventing individuals from going to incarceration. So that's just where my interest was in that. And I just wanted to know if there's anything that I can learn in today's conversation.
Thank you for your comment. I'm not sure that we've got a hard boundary on what is an ATI and what isn't. Say youth services generally are in that gray area, but they help keep kids doing good things, so I would. Can
it be an ATI for adults, people 25 or older or 30 or older? Yes. Because that's basically the population we work with. Right. Very rarely do we have somebody under 25.
No, I was just using that as an example, absolutely. And I was going to bring this same presentation to CJATI to have the discussion there as well, and Bridget's with us today, and so she's nodding her head. We will be having this conversation, and I would welcome more discussion among all those participants on, what we're doing from the standpoint of ATIs, and are there other things we should be considering? So, yeah. Shauna.
Thank you.
I think as we talk about this, the really difficult part for us as legislators is the fact that we're coming upon a really hard budget season. And ideally I know that we're putting in more than $1 million towards ATIs, and we would love to double that number. But the reality is whenever we're forced with people that don't have a place to call home, we're faced with just so many issues and so many needs in our community, it's really hard trying to balance those. And so, I think all of us around the table would love to pour in another $1 million, and whether that would solve everything or not, I don't know. But I think this year is going to be a really difficult one for us to continue to increase that amount. Just from my perspective, in seeing what the needs are of our community, and really trying to balance those needs. And while ATIs is super important, there's also a preventative part, trying to help people before they've committed crimes, before they're in our system. We have youth that are in need. We have people that are really struggling who don't have a criminal history with mental health, getting kids into those services, getting adults into those services. And so I appreciate the work that's being done by all the people that are on this call and around this table. But I think, unfortunately, I just wish we had more money. And we don't want to raise taxes. That's not where I'm going with that either. So,
unfortunately, Shauna, I think you're right about our budget coming up. Lee.
Just a couple thoughts in general. And, it's still in the back of my mind, is there going to have to be a multi-million-dollar investment in a facility, whether it's for the space or for the programs or the number of people. But, I think you're on the right track, Rich, and those are questions that we need to have answers. But for me, it's a matter of how we frame the discussion. And if the goal here is to minimize the number of people incarcerated, we've got some measures to work with, and we're probably doing pretty well with that. If our goal is a jail size to facilitate or effectuate public safety, well, that's a little bit harder to quantify or qualify. And, again, I think our goal here as a committee and as a legislature is to make our streets and communities safer, and the public safety building is one of many tools, including ATI, that does that. But when I hear today that you might have 8 people incarcerated related to the GIVE program, well, that's more people in jail, but it also indicates to me that maybe our streets are a little bit safer because of that grant and the efforts that are going on. So, and I don't ever want it to be said that we've sized a facility that impedes public safety, and if we need to be looking to expand in order to effectuate that, then, that shouldn't come off the table. The goal is worthy. Let's keep working on it. But, with any of these programs, as Shauna mentions, there'll be a lot of requests. Tell me how effective they are in not only reducing the jail population, but also reducing the threat to public safety. So there's where I come from.
Okay. Veronica.
Sorry, I'm racking up more and more things the longer I wait. I appreciate, Lee, that you brought up that how are we framing this? Because I was thinking that too. It's like, are we trying to just figure out how big the jail should be given current circumstances, or are we trying to see how can we change things to both achieve the goal of safety of the public, and also maybe reducing the jail population? Reducing the jail population is important to me overall, at least in a long-term thing, because I don't think being in jail is good hardly for anyone who is in jail. Sometimes in the absence of other options in the circumstance it is. Which actually, one more, I guess, question that I think, Jen, you kind of brought up, but that I would love to ask is to add to Rich's, is when there's people in jail who, they're in jail because why ever, but you, and I guess you all or whoever looks at them and thinks, well, this person is in jail, but really what they needed was something else, maybe that doesn't exist, like easier access to inpatient mental health treatment, or they needed a like this, that, or the other on their, so that they wouldn't have ended up there in the first place, or somewhere they could have been sent instead of jail, like on that night. I'd be curious to know what those things are, not like if it is like long-term mental health facilities or what have you, not because I think that the county can then just go up and start them, but I'd like to know.
I think, Veronica, all the things you mentioned are definitely needed. But I just want to point out the other side of that is a lot of people that come into our facilities aren't getting that, and they're not getting it until they're in our facility. That gives them an opportunity to get off the drugs they're on and hopefully get at least a little bit of psychiatric care through our forensic counselor and our mental health doctor. But sometimes coming into the jail saves them, so to speak. But all that stuff is definitely needed, and it's hard to speculate if that existed, how much it would help in our jail numbers. It's hard to say, but yeah.
Yeah.
Okay.
And I think what I'm saying about like, I don't think like jail per se, the jail aspect necessarily helps people in general, but in our context, yeah, like there are a lot of supportive services that are, you all offer in the jail that are unfortunately not accessible any other way.
Right.
As it is. About the budget thing, I think I totally take Shauna's point, and I don't want our budget constraints or perceived budget constraints really to limit the information we gather and how we understand this whole scope of like what brings people into our jail and why, and how many people like are we expecting to be there. So I guess I'd want to encourage like, let's get data and information even at the end of the day. If it's like, oh, here's solutions we can't afford, because some aspects of it might be cheap, who knows, like an open communication pathway or whatnot. And the last thing, maybe this is a question for the lawyers. A bunch of the questions were about, are the courts doing this? What are the judges deciding? So would it be helpful to try to get a judge or 3 at a meeting here? Is that weird?
I'm not sure it'd be harmful. I think they're, from my perspective, reluctant. They can't discuss individual cases. I think I think many judges are very sensitive about being asked why they're incarcerating people or not. Regardless of the decisions they're making, they tend to be uncomfortable about that. I don't know. It may not hurt. You may just get a bunch of generalities, kind of,
We have invited judges here before to talk, and they generally are reluctant to come speak publicly. But yeah, I don't know if you had anything to add, but I see Dan has his hand up.
Thanks, Rich. I think one thing I see in processing what everyone's sharing is maybe some private sector solutions as well as some of the not-for-profits. Supportive living situations like Lakeview Mental Health, if there was an expansion or increased capacity there, that would be helpful. I mean, just housing people but not assisting them with their daily needs, I think has proven itself to be folly at this point. Also expansion of Sunflower House, programs like that are proven to be successful. There is a need for both of those things in the community.
Okay. All right. Anything else?
I'll be quick, but it goes to Veronica's question. The decision to put someone in jail or set bail on them is always by the judge, right? So law enforcement officers aren't saying to themselves, I could either put this person in jail or put them here, right? So I think there's a little confusion sometimes. Obviously, I think the Detox and Crisis Stabilization Center would help law enforcement when we're on the road, when we see someone in crisis or they've committed a petty crime, and that might be an alternative. And this is just going off years of experience and that might play into a judge's perspective, just because I've heard these things talked about, is sometimes they're remanded or a certain monetary bail is set, hoping that that person gets the help that they need, because the jail is the only place that is going to provide it in a secure setting, right? So the detox and crisis stabilization centers are voluntary. You know, we might suggest you go there, but if they don't want to be there, they're going to get to walk out. So a judge wouldn't feel comfortable, this is my opinion, and based on experience, they're not going to feel comfortable suggesting someone go to a detox center versus putting them in a secure correctional facility, because when people are in a crisis or they're experiencing drug dependency, they don't always make the best decisions for themselves, unfortunately. So having maybe a detox or crisis stabilization center that has a non-voluntary part to it that would be secure, I think might be a benefit, and that might alleviate some of those concerns that the judge has on that person just leaving and not getting the care that they need, and then being a threat to themselves and public safety.
Yes, I think you're right.
I believe we did talk at one point in the past about having that component within the jail itself. I don't know if I'm remembering that incorrectly, but it seems like we did have a big conversation.
We did have that, yeah. I think there were cost considerations, but there would be some real benefit to having that capability in my mind. Okay, well, just to move this along, what I propose to do is I will add some of the items we discussed as additional questions. I'll share them with everybody, and I will give myself some homework to try to develop some answers to these questions from data and from all of you, if you have specific information you think would help answer any of these, so we can have an informed discussion in August. So, does that make sense to everybody? Thanks. All right. Okay, let's keep, I'm going to stop screen sharing. Let's see. Stop share. All right. Great. Let's continue with our agenda. County Administrator's Report.
Thank you, Rich. I do not have a report from County Administration with the exception of the resolution.
Okay, and this is the approval of updated amended bylaws, Criminal Justice Alternatives to Incarceration Advisory Board, ID 13410. Veronica moves. Shauna seconds. Bridget, do you want to speak to these?
Sure. So on packet page 45, you will see in red the only amendment to the CJATI Advisory Board bylaws. The language adjusts the residency requirement to include those individuals or members who are not Tompkins County residents, but are working for in service to Tompkins County residents. This allows us to fill some of the vacancies for service organizations, individuals who do not live in the county but are serving county residents.
Okay. Questions, comments? All right, are we ready to vote to approve that change to their bylaws? All those in favor? That's unanimous. Thank you.
Thank you.
We have one appointment to the CJATI board, and that's Jennifer Brownell. Could I get a motion? Veronica moves, Lee seconds. Questions or comments? All those in favor? That's unanimous. All right, and we'll move on to the Sheriff's Office report. Welcome.
Thanks, Rich. You have my written report in front of you. I just want to point out a couple things in there. I think URO left the meeting, unfortunately, but I wanted to thank them. There's a lot of pictures in there of our jail garden. They were instrumental in helping us get that up and running again. We had a lapse in time where it wasn't operational due to COVID, so it needed a lot of work, and they really stepped in, and we did a lot of media interviews last week. I haven't seen them myself out in print or on the news yet, but I'm sure they're there somewhere, so just thank you to them. They do really great work. You also see in there, we had a promotion in our jail for Corrections Sergeant, Yem Yan. She's been a fantastic addition to us, and you probably all saw my email when we had an incident in the jail, I think it was last week, with smoke filling up. poor her was new on the job as a sergeant and was responsible for handling that entire incident, evacuation. We also had 2 different groups of inmates take advantage of that situation and start fistfights. So her and I think maybe 5 COs handled that entire evacuation and stopped those fights and dealt with all that. So kudos to them for sure. They do a great job. Last thing I got,
Sheriff, just to go back, can you tell us, what do you do when you evacuate the jail?
We have very stringent policies and procedures in place to handle such incidences in different stages where we can evacuate them depending on what happens. The first step, I believe, is they go out into the rec yard. So they're outside the building. We have perimeters set up where our road patrol deputies come in and help with security. And I got to say, there was a couple little things we could do better. That happens every time we do one of these. But overall, it was just a phenomenal response, and I was really proud of the way they handled that. So.
Okay.
The only other thing, I would like to talk about Flock if you feel we have the time.
Absolutely.
Give you some updates
yes.
on that.
I did have one acronym question, UAS.
UAS?
On page 52. UAS operators course. 2 attendees.
Is that our drone? Yeah, that's drone.
Drone?
Yeah, we have 2 drones at the sheriff's office we use.
Unmanned aerial.
Yeah, something like that.
Okay.
Yeah, you got me on that, but it is a drone.
Okay.
Yeah,
thanks.
there's extensive training, believe it or not, that goes into operating those things, and a very hard test and exam that goes with it too. So.
Okay. But yes, Flock.
All right. Yeah, let me just update you where
we are. And Veronica found the acronym.
Oh, good. Okay.
Unmanned aircraft system.
Okay.
There.
It wasn't me that went to that training, I will say. I heard what the speaker said. I had a conversation with you, Rich. I think it was last week. I had a very good conversation with Veronica. I've heard a couple of the speakers that have come forward. And I just want to share, I've had numerous meetings with Flock. Thus far, I found them to be very good partners. I believe they're being accurate and truthful when they answer all the questions that have come forward. And some of the things I've come across, the data that is captured by these devices is ours. It isn't owned by Flock, it's owned by us. I mentioned before that, yes, the sheriff's office has a number of Flock devices throughout the county and some in the city as well. But it's important to know that, there's multiple agencies that are operating these devices beyond us. Ithaca Police have their own, Cornell. I believe there's at least one in Trumansburg, Cayuga Heights. So it is something that's kind of taking over, even nationwide, and even though it's kind of relatively new to the state of New York. Working with them, we are in the process, the undersheriff and I have been working really hard in developing a policy to try to address some of these concerns and have people in the community understand that, the concerns that come up, I have those same concerns. It's not me versus them. We all have concerns. I've seen several of the news articles as well. Some of the changes we've made as of last week, right now, our devices are only searchable and usable by law enforcement in New York State. Anybody out of state, as far as law enforcement, cannot even search to find out we even have these devices, and they certainly can't access them. I want to point out that's got good and bad. The good is we don't have law enforcement in Texas searching for people looking for rights in New York or other states. I saw an article on that. The downside is we can't search their cameras either. And I say it's a downside because heaven forbid, if we have a missing person, a child that's abducted, anything, and they leave the state, we're not going to be able to use that as a tool to help locate them. And I think I mentioned at Public Safety last month, we did have a missing person with mental health issues that we were able to locate using Flock in Pennsylvania. So, there's a flip side to every situation, but that's where we are right now. We also set up our search parameters as mandatory fields for our users in the sheriff's office where they have to enter a case number, and they also have to enter a field for the search reason. The undersheriff and I are in the process now of working on setting up what those search fields are. I know there's been concerns about overly broad searches, people putting in just the term suspicious. That is not acceptable to us at the sheriff's office, and I'm guessing those search fields are going to be probably modeled after our crime reporting to New York. So it'll be very specific on how they can search them. Immigration will not be one of them. They tell me that they have no relationships with federal partners, definitely not with ICE. Nobody has backdoor access to these devices. Believe it or not, that's what they're telling me. We are also in the process of working on a transparency hub to add to our portal on our website. It will show the number of devices, the type of uses that we've used it for, the search parameters, and give people an understanding in the community how we're using it and why. I'm hoping that goes a long way. And I think that's where we are right now. Oh, the last thing, retention periods. I know that's come up. Right now it's set at a 30-day retention period. Flock is telling me that out of 5,000 customers they have, only 10 have retention periods less than 30 days. It doesn't mean that we can't lower it ourselves. I'm definitely open to that conversation. I've yet to really identify for myself what benefit that would have for anybody in the community to lower that. Perhaps there's a reason that I'm not thinking of. But I would really caution us on limiting that at least too much. And I think that's it. So I'm open to questions. Once the policy is finished, I'm more than happy to share it with this committee for more input and conversation around that. I'd be happy to do that.
That would be great.
Yeah, absolutely.
And just following up on our conversation, Sheriff, for a lot of people in the community, they don't differentiate police agencies.
Right.
It's a police officer. And so if there's another police agency in the community that's using Flock in a different way, they're going to attribute that to all police officers. I would feel far more comfortable if there was a uniform approach across all the police agencies in Tompkins County. And I know that's a hard thing to do, but for the purposes of public trust, that would be a really powerful thing if there was an MOU that all of the police agencies agreed to so that they could share information within our community when it's needed. With that said, I see the power of the Flock unit or the system. I know it's not that different than just the license plate readers that have been in use for a long time, but having them placed at strategic locations can allow a really quick reaction when there's an emergency. So I'd hate to see us lose the capability, I really do. But I want to make sure we're addressing any community concerns, and it sounds like you're doing that, so thank you.
Yeah, and I'm open to continued discussion, and at a minimum, I know what we can do. And I've mentioned this to you in the past that my plan was to have other law enforcement within Tompkins County have access to these devices because it's a benefit to all of us in the law enforcement world, with the understanding that they would, at a minimum, have to sign off on our policy if we can't ever reach the agreement to have them all follow the policy themselves.
Yes.
But I'm certainly happy to try.
Yeah. Okay. Questions, comments? Does this make sense? Okay. Veronica.
I guess one thing, Rich, you said that the Flock cameras aren't all that different from the license plate readers in the cars, but I think, Derek, correct me if I'm wrong, but you told me yesterday the license plate readers in the cars don't save images, and
they save data, but they don't save images, correct?
Whereas these cameras do.
Save an image of the back of the car showing the license plate. Yep, absolutely.
Okay. All right. Anything further? All right. Thank you, Sheriff. Next up, District Attorney. Matt?
Thanks, Rich. 3 quick things. The easiest thing is one, we hired a data analyst. We were without one for a couple months. The new data analyst started yesterday, so I'm happy about that, and hopefully we'll have our dashboard current soon. We've not been updating it for a while now since the prior analyst left, so that's a great development for us. Second thing I can just add on to what Derek was saying about Flock. Derek doesn't control what other police agencies do, and that's fair. I control what is presented as evidence in Tompkins County in any case, regardless of a police agency. And we, just like other surveillance videos or facial recognition or flock evidence, it's a lead. It's a way to conduct an investigation, to get information to follow up on. It's not going to be the evidence in chief. It's not, we don't rely on that to get a conviction. It's something that leads law enforcement down a path to further their investigation, and for that, it's a really valuable tool. But it's not going to be the only thing that is used as evidence beyond a reasonable doubt in any case, and you know, that would be scary if it was, but that's not going to happen as long as I'm the district attorney. The last thing is, there was a little conversation last week on one of the social media, or Cornell Daily Sun did a story about fines, a specific person who hadn't paid a fine. And so I thought it would be appropriate to just talk about fines in general and my office's perspective on them. The only charge or conviction where a fine is mandatory in New York State is DWI cases and traffic. A lot of traffic cases have mandatory fines. A penal law charge, for example, whatever it might be, larceny or assault or lots of different things. Those don't carry, that you could ask for a fine, but it's not mandatory. So for example, a misdemeanor of stealing, you could ask for a $1,000 fine. We don't do that as a policy. We don't ask for fines as a policy because that creates a disparity. Someone who has financial means can pay that easily, and it's not a consequence to them, and someone who doesn't have any money ends up facing possibly additional consequences that for doing the same thing that the person with financial resources did. And that's not okay with me, and I don't think that's fair. I don't think the community would support that as a general principle. So that's the main reason why we don't seek fines. It's not really a consequence that has strong effects, deterrent effects, or other effects, in my opinion. We also don't take action to collect fines for a couple of reasons. First, the reason I mentioned about the economic disparities, but also we don't have the resources to spend time chasing people down to pay their fines. So that's just, you know, it's a difficult thing. You know, you would think that when someone gets a fine from the court, they will want to pay it. They don't want to worry about it. Eventually it becomes a public record, it becomes a civil judgment, and that is one thing that does have some power, because if that person wants to buy a house, or it affects their credit rating, if they want to buy a car, that's going to come up on their credit report, and so that might be an incentive to pay that amount. But in general, we're not going to garnish their paycheck. We don't really have the resources to do that, or the means, or the personnel to do that. So that's kind of just a nutshell explanation of my position on fines. And, you know, of course, if I had a fine, I would pay it. I think lots of people in the community, if they had fines, they would pay them diligently. But, you know, everybody's got their own personal financial situation, and it's just not, we would never seek out a punitive measure for someone not paying a fine.
I did see that story. It was unfortunate because the person is an elected official and didn't pay their fine. You know, as a lawyer, I've, you know, managed DWI cases, and it always struck me that the fine system in DWIs is dramatically different than really anything else, that judges have discretion in most cases, and that it's taken away in DWI cases. So I can understand treating them in a somewhat different way, because those fines are quite a bit higher than most fines you'd see otherwise. But I do have a little concern in that courts pass sentence, there's supposed to be a consequence to a sentence, and if they're giving a fine, it's generally as an alternative to something more severe. And if they never pay the fine, they've avoided some of that consequence. I'm not sure what the right answer to that is, but it doesn't sit as well as I'd like it to.
Give me another ADA and we'll take care of it.
Well, when I was on the DWI advisory board, we did look at the amount of unpaid fines, and it's a pretty substantial number. You know, there's a lot of money sitting out there that is uncollected. Yeah.
Just as the staff DWI coordinator, New York State just issued out an up-to-date uncollected fine Excel spreadsheet county by county that I'd be happy to forward because it's substantial and shocking.
I think that the committee members would be interested in seeing that, so thank you, yes. Yeah. Lance, it looked like you were going to say something.
We did have one of our investigators working on that list years ago. And,
yeah.
You know, it does, but it's a tedious process, making phone calls, and people have moved, and we don't have good addresses. It's
and a lot of them don't have the resources to pay. You're right, yeah. Veronica.
If a fine goes unpaid for like years and years, does interest or penalties accrue on that? Like, does the amount go up that they would have to pay if they want it to go away?
Once it's registered as a civil judgment, there is a statutory interest rate. I don't know the answer. I've never seen that. The statutory interest rate is 9%. So a civil judgment earns 9%. But I'm not sure if that applies to criminal fines. It does become a judgment.
Yeah, I think ones that don't become a civil judgment don't. I'm thinking of traffic fines in a court will sit there. They may end up with an additional $70 scoff fee. Their license has gotten scoffed in some cases, but that's the only additional thing that happens. And just an aside, at least with traffic fines, virtually all of that money goes to the state. So there's little incentive for a locality to, other than courts will pursue it, have different policies, but there's not and some are more aggressive than others, but there's little benefit to a community to pursue traffic fines because I think it's 80% or something is going to Albany.
Money doesn't come here, yeah. Okay, I'm watching the clock and we're pushing time a little bit. I should get Michael Steitley up here. Is there anything else, Matt, you had? No? Okay. Welcome, Michael.
Hello, how are you?
Good, good.
Good afternoon, everybody.
And given our timing,
Sure.
I just asked quickly, does anybody have any questions about the monthly report that Michael put together? I'd like us to talk about the fire training facility, but I didn't want to shortchange anybody if they did have questions.
Sure. And if it's okay, I just want to give you a quick update on CGR. So we are working very closely with them. They're actually on site today in the county doing interviews, and they'll be working with our fire chiefs tonight, and all the agencies are cooperating. It's been a really great partnership. So today we have Justin Van. He's on Zoom that will be giving an update on the training center. But just to give a quick highlight, we did have a special meeting with our fire chiefs at the beginning of the month. It was very well attended. We also had representation from county leadership. So I'm going to turn it over to Justin, who had an opportunity to speak with some counties that have already built some training centers and with a vendor who builds them.
And I'd point the committee members to page 69 and 70 of the packet. Yeah, welcome.
Hi there. So thank you for having me. As Mike did mention, we did have a meeting with the fire chiefs and some of the legislators back at the beginning of July. And just a quick little rundown for those that aren't aware. In that packet, you'll see that our current fire training center, we partnership with the city of Ithaca, and it's located on Pier Road down along the inlet and the Newman Golf Course. Current facility has a burn building that is no longer able to be burned in for fire training purposes. We have a one-room classroom with one restroom. That classroom is small, only able to hold about 24 to 28 students. A rope tower for rope rescue trainings that has a confined space simulator, and one storage shed, a covered pavilion, and a roof ventilation simulator. The pictures there show the burn building, the classroom, and then the rope tower and the garage storage. Some of the issues, concerns, obviously the main one is that we can no longer train Tompkins County firefighters in live burn scenarios in this facility. That's something that's an invaluable and required to become an interior certified firefighter, is you have to participate in live fire training. This facility was used for a number of years, but since then it's all concrete, so it's dried out and it's just been deemed no longer safe to burn in. It can still be utilized for search and rescue with the ability for smoke machine to put in artificial smoke, and but again, there's no live fire training that can be done anywhere in it. Other issues of concern is classroom size and limited number of classrooms. Can't do any breakout sessions, which a number of our New York State fire training classes require, as well as EMT, paramedic training classes also require. Obviously, with a large class, you only have one restroom facility, no storage or lack of storage for gear, equipment, training materials, no space for decontaminating gear and equipment. And this day and age, with the reports that come out quite regularly about the carcinogens that firefighters face, that is something that's very important to the fire chiefs of the county, having some place to decontaminate their gear before they load it back in their vehicles, and whether it's their personal vehicles or their fire trucks to return back to their stations. They are putting these carcinogens in their vehicles that they could be transporting their families back and forth. Parking is poor, to say the least, down there. You have to park alongside the roadway or the fence. And in the wintertime, it just piles up snow, so it makes it even worse, mud and everything. And then there's no indoor space to get out of the inclement weather to do any sort of training, like in a large truck bay or gymnasium type style would allow. So when we met the needs that we went over, obviously the primary need is a new burn tower. And then along those lines, classroom space, locker rooms with proper decontamination, shower facilities and restrooms, expanded storage, a cascade system to refill air bottles for trainings. Currently, we have to rely on either bringing the air truck from the airport down, or firefighters are having to take their bottles back to their stations to fill up after training, which can put a number of bottles out of service for them. So having something on site would be very beneficial to refill for multiple scenario trainings. Indoor space, garage space large enough to accommodate fire apparatus, and also could be used as indoor training space. And then rehab space for students to get out of the weather and rest and recovery during training. When I went over, I've talked to a number of different counties. Some gave a lot more detail than others. But just starting on the second page, Rockland County just recently put in a $3 million Commander Series fire tower. That's a pretty large tower itself, multiple stories. These towers can be configured any way you want. And when I met with one fabricator for the facilities, basically we can do anything we want. They can accommodate, and we can add it or build it so we can build onto it later to expand, or do it all at once. The majority of these and the ones that I've looked at online are all capable of doing that. Rensselaer County, that's the one that I look at that's kind of put it, that's what we're really looking for is what they have. I mean, they have a 2-story classroom building. I don't think we need a 2-story, but definitely large enough to hold multiple classrooms. But they have search maze, concrete around the building with proper drainage, and lots of different space. And that came in at $6 million. And that was an all-in budget for them, with a state-of-the-art burn building. Shenango County, they $600,000. As you can see, they did a quite detailed breakdown of the cost for their project. They had a lot of work done with county highway for labor for the prepping of the site and everything around it. They did a good job with contracting with a construction company to finish the few modifications that they needed. And they have a pretty detailed drawing, but that was just for the burn building itself. Albany County, again, they built two separate structures throughout their county, and with a total of $1.8 million for both of them. And again, as you can kind of see, DPWs are used a lot for the site work, which I could think, if possible, that would help with some costs and everything. Putnam County, $1.3 million just for their system. Is you can see, it says 10 boxes there. Their fire training simulator or building is shipping containers, and that's what a lot of these companies are going to these days. So they can be very customizable to add multiple ones, and they have 10 boxes stacked on top of each other, and they're pretty impressive to see. And they can be different kind of burn that you can do in it. There's a class A, which is straw and wood, just ordinary combustibles that they can burn. It's a more realistic fire, and class A simulators tend to be less expensive than a class B, which is propane fueled fires that are controlled by a control panel. And when looking at the same systems, if you were to build a 3-container, 4-container structure with a class B to a class A one is going to be about a third the cost. Again, that's the most realistic training for firefighters is the class A, but some counties prefer to go to the class B only because it does burn cleaner, and there are less carcinogens, but again, not as realistic and to a true fire scenario. And then, as you can see, Madison County, again, they have a large facility. I've actually been to that one. They have a great classroom setting, Also garage bay area where they do a lot of indoor trainings in the winter time, and when it's poor weather outside, they actually have a rope deck and a nice burn tower. And then Steuben County, theirs is in production now, and that's a cost of $360,000, and that's coming fall of this year.
Okay. All useful. Yeah, Shauna.
Yeah, I guess my question is, I'm the one that had brought this forth a few months ago and had asked to be part of the initial meeting and did not get the invite. Was wondering if there were other legislators that were part of this, or
I think it was just the chiefs had an initial discussion. I was invited, but I had a conflict, so in fact I was out of town. But certainly we'll make that available to you, Shauna, because we should be involved in this.
Yeah, we should be.
Well, what I was going to say is it looks like there's lots of counties that have gone through this, and so we have information on that. As a next step, I think it would be helpful to us if we could see a proposal. Here's what we'd really like to have, and using the costs from these other counties to try to get an estimate of what it would cost to build. And then the other conversation in parallel would be what kind of grant opportunities are there out there. But I think that's the next step. And Shauna, absolutely, we should be at the table when that's going on. Yeah. Anybody else? Does that make sense? Justin, Mike? Yes.
Absolutely, yeah.
Yeah.
And
we just,
the one thing that was brought up quite a bit and talked about is location then of a facility, whether we can find a place that maybe currently houses or has a building that would be suitable to renovate to be able to, for the classroom space or whatever, that could help with costs as well. So space is going to be, in location is going to be big at this.
And Sheriff, I know you had some interest in trying to have some training facility for your officers. Is that correct?
Yeah, exactly. As you recall, I mean, we don't have space at all at the sheriff's office. We've emptied evidence rooms to put office space in, and we don't even have a conference room really anymore with CAP taking over and things like that. So definitely interested.
And that's really the vision. I think sometimes we have a tendency to say fire training center, but it really is going to be an emergency services training center that will serve, police, fire, EMS, and others.
Okay. Does that make sense to committee members? Yeah. All right. Corsa. You're on mute.
Yes. So I just want to add that as part of the initial conversation that we had was to develop the framework for our conversation and understand exactly what we need in the county, and also develop a plan based on those needs that will be identified. So the next step of the process is working with Mike and his team to come up with a Tompkins County recommended approach and how much that is going to cost, and then engage with all of you to identify how you're going to fund it. And yes, I agree 100% with Shauna. She reached out to me to explore this opportunity with Cayuga Heights Police Chief, and they're very helpful and also set this whole process in motion. And I believe as part of the state's representative funding, there is some opportunity there that we can tap into, and I'm working with Bridget and everybody to make sure initially we submit some kind of proposal in place for funding as we build and develop the project. I think it's very early. We didn't know how much really we would need for Tompkins County response. Based on the initial conversation, we'll be looking at somewhere within the region of $3 to $4 million project, but we need to be able to concise the ideas and put everything in perspective and develop a framework that is affordable within our budgets, and also there are funding opportunity that we'll be able to tap in. It's a great initiative, and again, thank you, Shauna. It's wonderful that you brought this up. And Mike has demonstrated a commitment to help follow this through, and we will continuously update the legislature, the whole chamber, as well as Public Safety Committee on the next steps and the process that we are adapting to make sure we can bring this to fruition.
Okay, good. So I think we have a next steps plan. Good. And in the interest of time, I apologize, we need to keep moving.
Rich?
Yeah.
Before we lose Mike and Danielle, can I just throw something in here?
Yes, please.
Before you move from the department. I just want to say something to you. A little over a week ago, we had a pretty traumatic event for a number of responders in our community, and the critical incident stress management team was called in, and I not only got to see them, but experience the work that they're doing. And I just want to put a shout out from the Groton community and the responders, and thank you for that. It's a lot of investment of time and team building that's been going on, and it is very much appreciated. And thank you, Danielle, for responding so quickly in the middle of the night on a weekend and having the team out there pretty rapidly. Thank you.
Thanks for bringing that up, Lee. It sounds like this has been a really difficult time for Groton.
Yes.
Yeah. Okay. Department of Probation and Community Justice. Dan.
Thank you, Rich. Just a few things. I wanted to thank the Sheriff's Office for providing us with some secure storage in their limited storage facility for some sensitive items that we needed to put away in a safe location. And also thank Jen for providing me with information about their body-worn camera program so that I can start working on that as part of our firearms program for 2026, as was part of the approval of that measure. So we're working on that. I just want to throw in, based on the conversation earlier about fines, that we should also look at restitution, because a lot of people are ordered to pay restitution to crime victims, and we have a very low collection rate for that. And there seems to be very few consequences imposed for people who don't compensate their victims. On the most recent report I have from today, the 50 people that came off probation in the last 6 months were ordered to pay $34,850 in restitution and only paid 18% of that, but they were allowed to successfully complete probation without paying, which I think is an insult to the victims of crimes. There should be a consequence for, if restitution is ordered, they should be expected to pay it without it just converting to a civil judgment that the victim will probably never get. Just wanted to update you, the officers involved who are proposed to be armed all completed psychological evaluations through the Institute for Forensic Psychology. Everyone passed. This is the same provider that does the forensic psychological evaluations for IPD and the Sheriff's Office. Also, those same staff recently completed mandatory use of force training in Jefferson County. I wanted to thank Jefferson County for providing that training to us free of charge. That also included training on trauma bleeding and how to address those types of things. And just finally, a heads up. It looked like it was going to impact us this year, but it won't for 2 more years. One of our few revenue streams is the ability to collect DWI supervision fee that was passed locally by a local law that allows it, in addition to the state statutes. That was set to sunset in October of 2025, but it's been extended for 2 more years. But at that point in October of 2027, that funding stream is expected to no longer be part of what we're able to collect. So just giving any legislators who will be here 2 years from now the heads up that we'll be losing the ability to collect a little bit of money. That's my report for the month.
Thank you, Dan. Matt.
Thank you.
I just wanted to comment on that. I agree with Dan that restitution is completely different than a fine. Restitution is related to a specific victim. It's related to a number of damages that the victim suffered. And I think we will be able to do a much better job at it in combination with probation, when we have the victim advocate position, which we got the grant for, and we're able to hopefully fund that position going into 2026.
Thanks for that.
That will definitely be a big help.
And this might be something we have a little bit more discussion on when we have more time at a future meeting, because I think it would be useful to the committee members to hear about the issue of restitution. So,
thank you.
Yeah. All right, Lance.
I'll be, given the time issue, I'll be popular with everyone. No real updates, nothing new from us for the moment.
Okay, everything's going along okay?
Yeah.
All right, thank you. Any other committee member reports? Anything you guys want to share? Shauna.
I would love it if we could have an update on where we are with the illegal sale of cannabis and the local stores that are hopping up everywhere. I did receive a call this week from 2 different superintendents locally that are concerned that their students are getting their hands on illegal substance.
Our coordinated effort on that with the city of Ithaca is ongoing. We have gotten IPD involved to the extent of possibly conducting and or overseeing our undercover buys, so to speak, in order to assemble the evidence necessary to provide notice to the landlords. We've been coordinating, developing the legal arguments and the process. In terms of an exact date for our first case, I do not have that yet, but we discuss this regularly with the city, and we're looking at doing it in a matter of countable as weeks on both hands as opposed to months on both hands.
That's great, thank you.
Thanks. All right, anything else? I would entertain a motion to adjourn. So moved. Seconded. All those in favor? We're adjourned. Thank you, everybody.